How do NSAIDs for RA affect cardiovascular health? Imagine managing the pain and swelling of rheumatoid arthritis with medications that can also influence your heart health. That's what happens with non-steroidal anti-inflammatory drugs, or NSAIDs, which are commonly used to ease RA symptoms. These drugs work by blocking enzymes called cyclooxygenases enzymes, specifically COX-1 and COX-2. This blocking reduces prostaglandins, which are chemicals involved in inflammation, pain, and fever. But prostaglandins also play a role in how your blood vessels and kidneys function, which can impact your heart health. NSAIDs inhibit both COX-1 and COX-2 enzymes, but they do so differently. COX-1 helps produce thromboxane A2, a substance that makes platelets stick together and causes blood vessels to constrict. COX-2 produces prostacyclin, which helps blood vessels relax and prevents platelets from clumping. When NSAIDs block these enzymes, they can upset the balance between thromboxane A2 and prostacyclin. This imbalance can lead to higher blood pressure, fluid retention, and an increased tendency for blood clots, all of which can raise the risk of heart attack or stroke. People with rheumatoid arthritis already face a higher risk of cardiovascular disease. Chronic inflammation from RA speeds up the development of atherosclerosis, the buildup of fats and other substances in the arteries. Many RA patients also have other risk factors like high blood pressure, smoking, or abnormal cholesterol levels. Because of this, using NSAIDs requires careful thought. While they help control pain and inflammation, they can also make existing cardiovascular risks worse. Interestingly, some recent studies suggest that the cardiovascular risks linked to NSAID use in RA patients might not be as high as in the general population. This could be because RA patients often take NSAIDs regularly over long periods, and the anti-inflammatory effects may partly offset some cardiovascular risks. Still, the risk is dose-dependent, meaning higher doses and longer use can increase the chance of problems. For example, naproxen is generally considered to have a lower cardiovascular risk compared to drugs like diclofenac or certain COX-2 inhibitors such as celecoxib. NSAIDs can also cause fluid retention and raise blood pressure, which can worsen heart failure in some people. Because of these factors, healthcare providers usually recommend using the lowest effective dose for the shortest possible time. Regular monitoring of heart health and blood pressure is important, especially for those with existing risk factors. Sometimes, alternative treatments that reduce inflammation without affecting cardiovascular health are considered. In summary, NSAIDs for rheumatoid arthritis can influence cardiovascular health by disrupting the natural balance of blood vessel regulation and promoting conditions that increase heart attack or stroke risk. While RA patients already face higher baseline risks, NSAID use adds another layer of consideration. It's essential to work closely with your healthcare provider to weigh the benefits of symptom relief against potential heart risks, and to tailor treatment plans to your individual health profile. Always seek personalized medical advice, and remember that managing RA effectively involves a careful balance of treatment choices to protect your overall health.